My name is Tibs Pereira and I'm a member of Patients for Patient Safety Ireland. It's a group about engaging patients and to enable people to be advocates and partners in their own care. So a lot of what we do is about working with other groups, like the HSE, so that everyone has an opportunity to increase their level of health literacy.
Research shows that informed and empowered patients result in better outcomes and a more effective and efficient health service.
When somebody is sick, and when I'm a kidney patient myself, and when I first got diagnosed, it was such a shock to me that I wasn't, and I felt pretty ill as well, that I couldn't take in information. So waiting until someone is ill to try and educate them is not the best way of doing things. But it's important to look at both sides of the equation, looking at healthcare professionals as people who can empower the patient, but also trying to inform patients themselves as well. I think e-health can be a big agent for those changes to enable people and empower people to be more self-managing and more, to take better care of their own health, but also manage their condition more effectively. It used to be quite tricky, for example, for me getting a blood test, which I need to do every few months or so. But now I can book that online, and it's so much easier. I've got a time slot. I know within 2 or 3 minutes of that time, I'm going to be seen, and it makes things so much more efficient. Simple things like that, quite often it's the simple things that have the biggest impact. For patients, and everyone is a patient, right, at some point or another. There's nothing worse than sitting in a waiting room, not knowing what's going to happen and so on. So, simple things like booking appointments can be so effective. And there's a big role for e-health to play in doing this, whenever you're designing apps, whenever you're designing any kind of new service for people.
Each of you in e-health has a unique, once-in-a-generation opportunity to unlock data and empower people not only with information, but also with the knowledge, skills, and confidence to be active partners in their own care.